guys. Hey everyone, I'm Dr. Casey with Birmingham Health, and today we have Mandy with us, of course, and we also have some guests with Birmingham Wellness Massage. This is Bryce, and this is Anne Marie. I appreciate you guys joining us today, and today we're going to be talking about a few different things. First of all, we got to talk with Anne Marie, and it was so good to talk with some of your story, and you are a major CrossFitter.
Well,
for how long?
I wouldn't say major.
We're going to see you compete for a championship. We'll see you on TV.
No. Okay. Masters level only. Yeah, I've been CrossFitting for about 10 years.
Awesome.
Over 10 years.
What made you say, hey, one day I want to go just bang out some push-ups and pull-ups at CrossFit gyms?
Well, I really never thought about it. I didn't know anything about CrossFit, and the CrossFit I started going to was brand new. But I was in my chiropractor's office and saw a sheet from somebody, her before and after, and how she was enjoying CrossFit, and chiropractor had been saying to me, oh, this is a great thing to do. It's a lot of body weight movements. So I went down there expecting body weight movements, not so much barbells, but I fell in love with those barbells.
There we go, slinging and clanging and banging.
Yes,
I hear you.
Absolutely.
Well, walk me through, like, does CrossFit, obviously it's giving you some great results, but has it given you some injuries too? Or tweak some things?
I would say, yeah, definitely some tweaks. Okay. Most of the injuries are because I'm super klutzy, so that has happened. Like, I've sprained my ankle because stepping up on a box holding a kettlebell came down my ankle, went, and that hurt.
That stings.
Yeah, fell outside running and, scraped out my knees. I also broke my big toe because I dropped a weight on it. So, little things like that set you back a little bit.
Little things?
Yeah,
I think a broken bone is more than a
shoulder, little thing going on with my shoulder.
It's almost like when somebody talks about nails on a clawboard and somebody talk about it, you feel it. I'm feeling the injuries right now.
So it definitely bangs you up a little bit.
So you've kept your chiropractor in business.
Yes,
and your massage therapist in business.
Absolutely. It's the only thing that kept me going through all of the 10 years that I've been doing this.
And so one of the things you even brought up was a great thing too, was you talked about your IT van. Walk me through what's going on in the IT van.
Yeah, so I'm not really sure, but it's kind of bothered me off and on since I was in my 20s, and pain will kind of shoot from my hip down to my knee. I can find points down my IT band that just hurt. I roll them. I've got a massage gun, and so I'll massage through that. Ice it, do all those things, but it still just kind of flares. So that's kind of there.
Many times, like when we see this, and you probably see it in your clinic quite a bit, and patients care over years, but we see things all the time. It's like, why is this symptom, we'll pick on IT van syndrome, not getting better? I've done everything. I've seen everybody. I do everything at home. This thing still flares up. And so to me, it's not necessarily like you're not seeing the right professional care or doing the right attention at home, like home care type things. Sometimes we got to look at like what's aggravating it, and are we continuing to do things that are aggravating? What are all those aggravators? That's what, once we resolve that issue, it's like now the body can catch up. So who you go see for massage, or who you go see for chiropractic, or all the things you do at home and help for it actually become more and more and more effective once we can figure out what is that big missing puzzle piece. In this case, it might be an aggravator there.
Right.
And
like
so
running.
we got a patient that just started with us, and he's done exactly what I just said. He's been to all orthos, all neuros, many chiros, many PTs, and he's done all these different things to try and help out with what is going on with this. And I'm still in the same problematic state. Well, we started off with some basic x-rays to say, well, look, if your pelvis is all twisted up and out of whack, it can be like that for different reasons. But if it's all shifting one way, you actually got one bone longer than the other bone, which may have been born that way. And what you have to do is put a small heel lift in that short leg shoe to raise it all up. And once you do, like everything that's being pulled out of bad suspension, that's inflamed and irritated and out of whack, gets to finally calm down. And so then all those other things and all those other puzzle pieces actually start working.
That makes total sense, because sometimes like my pant legs, one will be higher than
the other. Absolutely.
And then when you get an adjustment, then that pulls that back into the right.
So the thing to figure out is like, is it something that you were born with and that needs to have a little bit of assistance, like a heel lift or something like that? Or is it something that we call postural, meaning, you've trained your body to get out of whack and you got to retrain it to get back to where it needs to be and be responsive too.
And it's more common when we see those that need heel lifts a lot more than I would think that, it's more common than I thought it was.
Yeah.
We see it a lot.
It comes in very regularly, and when people put it in, they're like, "Oh, I train them to think like they're not going to be a new person. Like you're just going to feel like you're stepping on something first. You're not going to feel like this whole new person because you put the heel lift in." But it starts to calm that aggravator down, and then now all of a sudden everything starts to become more effective because it's almost like if you have the whole house on fire and the firemen are on the front side of the house spraying it down, and some jackwagon on the backside is throwing gasoline on it, right? we got to balance that equation and cut out the aggravating part to get the inflammation, the fire to calm down. But when we see it for after a long period of time, if they were born that way and things need that heel lift and that support, well, you got, depending on when they see us, but we got a 40-year-old patient, 42, coming in, and I mean, you feel the knots all over his back. Mm-hmm. I tell him, I was like, you've been training that for 47 years, and you're going to need some help on a regular case. So we'll be sending you a client here shortly because of that.
Right.
Because you have to address that in addition to all these other things too. So if you find yourself kind of like in that rut of like, what is going on? What is being irritated? And I've seen everybody, I'm so frustrated. Nothing's working. Well, we got to find out what are all those aggravators. And once we figure out what those aggravators are, I think we'll start to figure out this forward momentum that you need there too.
Nice.
Absolutely.
Yeah, that's good.
Yeah. And so, but we see different types of cases in here.
Mm-hmm.
And
I try to think of people that you guys have in common. You have certain clients that we see, and he has certain patients that come to you. Mm-hmm. And one of the biggest things that I needed last year was when I was pregnant, I needed to be adjusted regularly, and I needed massages regularly. So what are the benefits that both of y'all could...
First off, when you started to do that, what did you see a difference in?
Oh my goodness. Well, you also did acupuncture on me. I had very high anxiety when I was pregnant. I was just nervous, and so he did the acupuncture for anxiety and fatigue, and then I felt certain relief because I had a pelvis dysmorphia situation, and he would adjust me for that, and I would immediately feel relief.
Good. And so didn't have to do pregnant, didn't have to take anything that would hurt the baby or hurt you while pregnant.
No, I mean,
and
I was at the
issue
perfect place to be while pregnant. I mean, I was here.
Yeah. And then, you guys see pregnant clients too?
Oh, absolutely. Yeah. I'd say...
What's a common complaint that may come in with your pregnancy clients?
Low back. You know, typically one side or the other, they just feel off. And so a lot of times, if we see that lady at, her 4th or 5th month, they'll get that relief and go, oh, wow, okay. They feel whole again on some level.
Yep.
And then the closer that they get to the baby being born, the more often they'll kind of get on that rhythm.
Yeah, we identify exactly the same thing because of how much physical stress that happened over a very quick period of time. Because if I'm not mistaken, you said you've had a child too?
I've had 2.
You've had 2 children. And so, you probably can identify in those last 2 to 4 weeks are a heck of a lot tougher than the very first few, right? Awful. But overall, the course of 9 months, that's a very quick transition to have your body morph into this certain way. And so, it's going to put challenges on different areas.
And you don't know what kind of position the baby's going to be in when you wake up in the morning, because you could walk to bed fine that night, wake up the next day, you got a creature on the side, and you have to walk a little different.
Hitting your sciatic nerve, and you've got the pain shooting
Yep.
down your leg, and you're just in agony. Yeah.
So, and what do? You take some muscle relaxers then?
Not when you're pregnant.
So what are the options? What are the other options? I got to do something. This is killing me.
That's your options.
Yeah, and so you'll see that you probably. Did you ever get it when you were pregnant? Did you get adjusted, or did you see massage at that point in time?
No, I had one massage with my second pregnancy. That was sort of like, I guess, my little present before I had her, and I thought it was so wonderful.
Yeah.
It just made me feel so much better, and I was probably 4 or 5 weeks away from delivering her. So I wish, we're talking more than 20 years ago, I wish I had known more about those options for me when I was pregnant.
Because you said you have seen a chiropractor, and you started seeing a chiropractor.
Saw me a few times in my 20s.
In your 20s.
But regularly about 39.
And when were you pregnant though? What age were you when you were pregnant?
I was 28 when I was pregnant with my first one, turned 29 right after she was born, and then 31 when I had my second.
So you're kind of like my wife and I at the same time too. But let me ask you this: why? you said you started to see a chiropractor, got pregnant, stopped seeing a chiropractor. Why did you start doing that or stop doing that? What was your fears about it?
I just didn't know enough about it.
Okay.
I really wasn't informed enough about what a chiropractor could do, and I guess it scared me a little bit. I saw him just a few times, and it was mainly for a shoulder. It's probably the same IT band thing that was bothering me, and was bothering me then. So yeah, I just didn't know enough.
Very common. I can't tell you how many times you probably heard conversations in the clinic when we talk about women that surprise the conversation. They actually do it in a funny place. They'll whisper to me, "Hey, I'm pregnant." I'm like, "Awesome! That's awesome!"
Yeah.
It's like that's a bad thing. Like they're in your shoes where they have to stop doing something they found that they've enjoyed that helps them, and they're fearful. They're like, "Well, I guess this is going to be the last time I see you for many, many months." I'm like, "Oh, this is the very start of it."
See you on Tuesday.
Yeah. But what ends up happening is a very common thing to not know how chiropractic can help somebody through all development ages of pregnancy, even pre-pregnancy, to helps them get their body healthy to a point to where it can help them get pregnant, stay pregnant. But then it's like they find themselves pregnant. Well, in trimester 1, it may not produce all the pain-related things that might bring people in.
Produces the nausea.
Yeah.
But it could,
Acupuncture can help that.
Yeah, that's what I wish I had known that. I was so sick. Like for the first 5 months of my first one, acupuncture would have been wonderful.
And sometimes it can be in a way where we do it once or twice and it eliminates the nausea. But sometimes it just needs a little bit of help because things have been bottled up for a period of time, and we got to retrain to go different ways, if you will. But yeah, no, it's very common to have that fear about it, and we kind of sometimes see patients in their worst stages of fear where the sciatic issue, and they are in their 3rd trimester, and they're like, "Oh my God, what is left to do? I can't take, I've been in my traditional doc, but I can't do the things that they want to do. Like I feel like that's going to harm me and harm the baby. So what is out there?" And they finally see me, and I'll walk them through and I'll calm all their fears down. I'll say, "I wish we'd found you in your 1st trimester." I don't think that we would have 100% avoided sciatica or SI joint dysfunction or varying ligament pain, a lot of these types of things that you guys face. But it would have been a hell of a lot easier to respond quickly to the treatments at that time too. And it would eliminate probably the pain that you're facing at that point in time and reducing that to a certain point and probably eliminating it too. So I wish we'd have known each other then. I'd have told you that story then.
You probably were a little kid then, but okay.
Yeah, that's all right. I'd have shouted louder. But in general, I wish that we could get that word out to more females that are trying to get pregnant and trying to have a healthy pregnancy, because we even see most of our patients have a healthier labor and delivery time, which I'm sure you guys, when they implement all the soft tissue work, do your females come back to you later and just say, "Hey, the labor and delivery time wasn't nearly as bad"?
Yeah, I mean, for the most part, they have to kind of give it that and ask. There's a question I had: is there a particular period of time after the baby is born before they should start coming back?
So that's the 4th trimester, right?
Yeah, there you go.
So it is actually some of the most important parts for recovery, depending on how intensive the labor and delivery was. We may switch things up, but it's important for mamas to come back in pretty soon, within a week of coming back. And we don't have the misconception of chiropractic and how physical these adjustments can be. It can be very different at different levels and different stages for different patients. And for our pregnant moms that have come in, no, it's not going to be very physical. Right. But there are things that will help their body respond way more quickly and get them back to a more normal state, or whatever their average or normal state of feeling that they used to be.
Right.
After that 4th trimester has dissipated, I guess.
Similar to us, when they will come in, 1, 2, 3 weeks after they have had a baby, we're not doing a deep tissue. We're doing that light, Swedish. We're just trying to get everything calm.
Yeah, they've had
kind
enough
of back.
nurses pushing on their uterus for.
Yeah, don't poke that, poke this, right? Help this out, right?
Right.
But in general too, outside of pregnancy cases, we see that quite a bit. I don't know if you guys have any bouts of arthritis in yourselves or other patients too.
Oh yeah, we definitely see a lot of clients that have that where they think, I've tried all these other methods, I'm always in constant pain. They get a massage and all of a sudden they're going, now I'm able to rest easier. I'm able to sleep better, and they get back on that routine, and it's something that they're not taking a pill for, you know. And they're absolutely.
How many pregnant women with arthritis do you see?
Well,
potentially, you're not going to X-ray the patient during that time frame, but
absolutely.
You know, some people think that even sometimes that arthritis is like it's a death sentence. I got the arthritis. I'm like, no, it's there, but you know, let's flip that script a little bit and say, yeah, you do. Why do you have that? And what do we got to do to move out of that? But yeah, we have patients that come in that have in those beginning stages or even more moderate stages of that too when they're pregnant. Sometimes we find that out later once we can X-ray them, or sometimes they bring the X-rays that they had before pregnancy, and they come in. I'm like, well, you know, this is a weaker area, and it's going to probably show up during your pregnancy at some time. But also too, it may not even be present quite on X-ray, but we're going down that arthritic route because where joints are stuck and not moving, and muscles aren't sliding and gliding the way they should be, starts creating a lot of problems for us. And I mean, how many conversations of that do you hear in here?
Oh, a whole lot. And I get so excited whenever the pregnant women come in, because then we get to see their babies.
Oh yeah, it's such a. They're like, oh my God, you're just babies. I'm like, yeah, and they're like, you're not touching my baby.
I think I was in here a week after I gave labor. I was like, hey, Dr. Casey. Me than her.
Yep. And it's because she became aware of the things, because I think Anne Marie, you talk about like not knowing certain things.
Right.
You just don't you don't know what you don't know. And part of that fourth trimester is not just for mama, it's even for baby too, because it was physical on you guys. I got to observe for my wife, but I didn't get to feel what you guys have been through. But it's physical, but it's just as physical for the baby in a sense where if you could just take the same things that happen when we were retrieving a child, whether it's cesarean or natural childbirth, and you bring that baby in here and you let me reenact it, you're probably going to, all the same things I would do in a chair to your child, you would kill me first and maybe not even call the cops, right? It is a brutal scene, and it's physical on the child as much as it is on mama. And so it's very important many times to see that this child start to get things back into normal working condition when it hasn't produced the pain problem yet. But we see it all the time. Like, what are some of the top things that mamas bring their kids in for that you hear of?
Colic, that's the newest,
Yep.
you know, for the newer babies. And then there's ear infections that come later. Even like a little bit older, there's like bedwetting he can help with, or allergies.
Yeah, it's like bedwetting, like 7 years old, still wetting the bed, right? There's like, why is that? It's against your brain and your spinal cord overactive, creating components that's not allowing your body to act normally. And so a lot of times we even see when they see those real chronic conditions, that's when they actually have to make sure, even at 7 years old, and they don't have all these tight issues that us adults do that are CrossFitters, that they need to see some degree of tissue work. And so that'd be something that, I don't know if you guys see a lot of pediatric, you know, but you'll see that sometimes that's going to be a big funnel there to help out those conditions.
That's great.
Like we see like a side effect of having these issues would be like torticollis in a child, and this tight muscle in the neck. Well, you know, what ends up happening in the traditional world is they go to their pediatrician and they see torticollis. Okay, well, let me do some work and massage this out and stretch this out, and you go home and stretch this out, and here's this prescription, take this to help out with that. That's the traditional way of handling it. But sometimes it takes a very long time for that to get the results, where we could have gotten there quicker had we started taking care of the root cause of the problems and addressing it the right ways. And so once you do that, then all those other things, you know, are probably even unnecessary at that time.
Right, especially the medicine. I mean, I've got two girls. The first time Dr. Casey saw my oldest, she was, 3?
Right at 3.
And had I known, she was colic for 6 months when she was a baby. And had I known all the benefits, I would have been here every day. But that's why my new one.
Yep.
Here you go.
Come on. And so, you know, we talk to our patients too all the time, like about this Band-Aid approach. Like, what do you want out of this? And you tell me how many times people will come in acutely to then want the quick fix.
Oh yeah.
You see that?
Oh yeah.
So I'm not alone. We're not alone on this.
And a lot of and surprising, but some folks will be like, well, I just didn't, I thought I'd be all better. I used to get massages and I was all better. Well, as the body ages, and if you're not being that proactive, it's a longer recovery period. And so what's interesting is I try to help folks on the front end go, okay, and I know it's similar with chiropractic on some level, is saying, okay, so for your first massage, your recovery period, your body may feel good for a day or two,
right?
Maybe up to a week, but the more you come in, the longer that period is going to settle into your body, where you may need a massage twice a month for a while, and then it can back off to once every 3 weeks, once every 4
we call that the holding period. You're training your body to hold for longer, because you've gotten it conditioned to be so responsive towards everything that happens. And so when we first start, it's very effective, and people start to feel better. Like, yeah, I'm fixed. I'm like, yeah, until you go bowling tonight. And then what happens? Your arm and shoulder's out of whack again, so we got to repeat the process. Don't go bowling tonight now. Let it calm down, let it get more responsive, let it start holding. And then over time, you'll start seeing those same things. It gets better for longer, and you're not as much on this pain roller coaster, what we call it.
Right.
So
I know a lot of you, or both of you, see a lot of athletes. And I know that you mentioned bowling, but y'all see professional bowlers, or...
We see NFL athletes, former NFL athletes, college football players, people that are getting into college football, soccer, golf.
Oh, yeah.
We see
golf,
it all.
Runners, CrossFitters.
Amen. CrossFitters keep us in business.
Yeah.
Right.
Yeah.
That's how I ended up here.
And I will say, cyclists, what's great is there's so many avenues of wellness where you can get out and find something that you love on the weekend or in the mornings. But for me, it was when I hit 36, and I love playing Ultimate Frisbee. And I took a weird fall, and I did not recover the same. That I started going, okay. I was already doing chiropractic and massage, but then it really meant something. And it was like, okay, now I get recovery. I see what's going on here.
Well, you're not just an Ultimate Frisbee guy. You're a basketball guy, too, man.
I love playing basketball.
Shooting the threes.
That's my thing. I enjoy doing that a lot.
That's right, man.
I did not know
Keeps
that
me
about
active.
you.
So, many people, as you kind of hit the head on it with this, was you're talking about you didn't quite have the perspective that you do now about things that you need to do, so you can do these things. You can still play hoops. You can still get out there on the field and launch frisbees, right?
Yeah.
But what happens, if you don't do those things? Let's say, or not the Ultimate Frisbee and basketball. Let's say you don't do the tissue work. You have the tissue work on you. Or you don't maintain some degree of regular chiropractic. What does that happen to you then at that point?
Well, I see a lot of folks that I play basketball with that they have an injury, and we don't see them for 2 or 3 months, and they hobble back on, and then a few months later, so they have other ways of recovery that we may not think is the best in terms of
all day.
But what's interesting is one thing that I learned that was huge was a new piece that I'd lost. Is in high school, you learn when you play a sport, you better stretch, you better warm up, and
cool down. Golly.
And I was playing basketball, 20s, 30s, and it wasn't until a PT reminded me, I was getting, tweaking an ankle or doing whatever, and he goes, well, what are you doing with warm ups? And I was like, what are you talking about?
Yeah.
And he showed me some YouTube videos, and I got out there and I was like, what I did in high school,
That's right.
So in terms of chiropractic, massage, warm-ups, that helps me be mobile.
It's funny, how we are in society. Different societies do different things, and out in Japan, I got to witness this. My brother was in the Navy, went out and visited him for a week, and I got to see all the Japanese workers before they would start work, before they're clocked in. I don't even know if they're clocked in or not, but before they start all their stuff, they're warming up like a football team would.
Good for them.
They're not lining up in contact drills, but they're stretching, mobility, and what that happens is that you see in the workforce that it's reduced, workforce injuries.
Absolutely.
So
wow,
that's pretty smart.
Workman's comp, went down, right, for these businesses. Great. So, I mean, I can imagine your own personal workman's comp for you in basketball injuries, got a little bit less expensive because you started taking care of those things.
Totally.
But we see people all the time, like when they say injury, or when we say, well, did you ever have an injury? Man, they think like concussion, gashing wound, like major events, like where they had to go see the surgeon about things or was taken to the ER. I'm like, well, that's a type of injury. That's a macro trauma creating a really nasty event that you have to seek professional help about. But many times it's like you're just out there on the court. How many people just kind of roll an ankle?
Oh yeah.
Right? Was that an injury? Oh no, I was fine. I got to finish the game. I kept playing, and then 5 years later, what happened to that ankle? Right?
Right. Well, like I came in to see you last year because a young guy decided to jab me right here in the rib.
Oh baby.
He meant no harm. He was going for rebound. And what was great was you gave me some awesome things that I could do to help it out.
It wasn't even chiropractic stuff.
Yeah.
Like it was.
One was K-tape, and one was ice.
That's right.
It was great.
And you got on there. It helped out. It helps you get back to the court quicker. So.
But you were able to modify.
Elbow him back, right?
That's right. But you were able to modify your adjustment. I think sometimes people think, oh, well, I got this part that's hurt. The chiropractor would.
That's not a chiropractic thing.
Or they might hurt me worse.
Yeah.
But like my rib, but I was able to let you know, and you modified the way that you adjusted.
Yeah, a lot of people think he does the same thing for each patient, and it is very different because your story's different and your body's different. So
your goals and your athletic pursuits.
Right.
Absolutely.
Like I'm not going hiking every weekend. I want to, but I just don't. But if that were the case, he would modify that for me.
Yeah, every story is different. Most of the time I'll say, well, I'm glad you told me. So else do this, right? So, well, outside of that, is there anything else that we wanted to discuss today that you had on your list?
That's all I have on my list. Is there anything else you'd like to add, Bryce?
I think we're good to go.
Well,
Right.
Anne-Marie, Bryce, thank you so much. Mandy, always being with you on camera. Thank you guys for joining us, and we will see you on the next podcast.